Well, good afternoon, everyone. Today is April 7th, 2021. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency medicine physician with Dartmouth-Hitchcock Health. And this is Medical Matters Weekly. It's a show about the aspects of healthcare that matter to you most. You can submit your questions on Facebook Live, and we've received some questions ahead of time at our email address. And my guest today, I'm very excited to have, is Dr. David Veltre. He's a hand and upper extremity specialist at SVMC Orthopedics in Bennington. Welcome, David.
Thanks for having me here, Trey.
Yeah, well, we're excited. So David's been here about a year, and we haven't actually gotten a chance to spend much time together because of COVID. So I was telling him I'm going to use this time to hang out with him and enjoy the show. He received his bachelor's in mechanical and aerospace engineering from Cornell. I feel like we have a theme. David, you're like the third engineer gone physician we've had on the show. He has a master's in biomedical engineering from Cornell. Medical degree, Boston University School of Medicine, orthopedic research and orthopedic surgery residencies at Boston University Medical Center, and then a hand and upper extremity fellowship at the Cleveland Clinic. And after all of that, you're about ready to retire, I would imagine.
Just getting started.
Just getting started. That's great. Well, we're excited to have you in our community, serving southern Vermont and the eastern part of New York and the northern part of Massachusetts. Not many hand surgeons around, and I know that you were extremely busy on about your first day. So that's great. So just to get us started, tell us a little bit about yourself personally, where you're from and where you grew up.
Yeah, thanks. So I grew up in northern New Jersey, a town called Cedar Grove, and a little suburban town between a couple other bigger suburban towns about a half hour west of New York. And I spent I brought up there. I went to Cornell, as you know, and I spent most of my adult life in the Boston area where I worked as an engineer, and then later went to medical school and did my orthopedic training. So I've kind of always been up here in the Northeast between Jersey, New York, Massachusetts, and now working in Vermont. And I love it up here. This is kind of where I want to be. And it's really exciting for me and my family to kind of start growing some roots now after being kind of temporary living in a lot of places over the last decade or so.
Yeah, I'm sure your family is excited to now be in a permanent location. And, we had talked about this a little bit over a year ago during when you were being recruited here and looking at different places. But what were you doing in engineering that kind of led you, or maybe that's not what led you into medicine?
Well, yeah. So, I actually started off in engineering thinking I would actually do the aerospace side of things. I liked rockets. I grew up kind of wanting to be an astronaut, one of those kids. And I remember there was a point in there where I saw a lecture by someone who was making an artificial heart. And I was like, this is the coolest thing in the world. I want to create devices that can help people live healthier, happier lives. And so since then, I kind of switched to biomedical engineering and focused on biomechanics for my undergraduate degree. And then after my undergraduate degree, I didn't think I had enough bio background, so I did a master's in biomedical engineering to learn more about biology, drug delivery, physiology, all of that. Had a great year. Took a lot of extra classwork and did some research and in cartilage repair, which was timely because later on now doing orthopedics is one of the things that I work with. So I worked for about 5 years. As an engineer before deciding to make the switch and doing something a little bit more directly related to patient care as a physician.
So I imagine, for our audience out there, biomedical engineering, they can probably kind of figure out a little bit about what that means. I'm sure it means more than they and myself would think. You talked about artificial heart valves. What other things are out there that are that you were working on personally or about being worked on?
Yeah, I mean, biomedical engineering is a relatively new field of engineering, and it encompasses a lot. So, traditionally we're all in silos: mechanical, electrical, material science. So all those things kind of come together when you talk about biomedical engineering. The biology has to work with the engineering. And I studied biomechanics, so within the biomechanics field, there's a lot of work done in kind of the orthopedic side, which is what I'm doing now, which is, the structure of bone, how to recreate bone, how to 3D print bone, how to do all these things. And you can go on and on about all those, about the different areas of research. I think the stuff that excites me, as a former engineer and now an orthopedic surgeon and hand specialist is the biology part of creating bones, from nothing really, from 3D printing and creating cartilage like that, biological structures that people are creating. None of that stuff quite has hit the mainstream, and it's probably going to be several more years before trials and everything can get underway. But that's one area that I think is fascinating and something I'm personally very interested in.
So an example that if someone injured a digit significantly, particularly the bone aspect, you'd put like a prosthesis in there to replace that?
Yeah. So, I mean, it runs the gamut, right? So there are people who are 3D printing metal implants. And so it's a custom implant for your finger or your wrist or your knee. There are people working on developing custom bone implants. So they would grow bone or at least the structure, the scaffold of bone. You import it in and let your body kind of fill in the rest of the structures in there. And both of these are still in the experimental phase. I know there are products that are 3D printed and used in surgery, but none of these are mainstream yet. But certainly I think within my lifetime and hopefully within my career, I'll get to be able to use some of these as they become more mainstream.
Yeah, that is exciting. It's terribly exciting, especially as an emergency physician, where unfortunately I get to see a lot of the trauma, much of which does occur on the hand, and wonder about what can we do in the future to preserve some of the function. And we'll talk a little bit more about that, about what you do and what you can offer here and what you've seen. But just first, you've been here about a year, is that right?
Yeah. We moved here in August of last year, kind of mid-pandemic, but it's been almost, we're going closer to a year now.
Right, and you're in the Williamstown area with an office there as well as here in Bennington.
That's right. Yeah, we really love the Williamstown area. We love the Bennington area too, but my wife and I just really enjoy the college town atmosphere here. It actually reminds me a fair bit of Cornell. Cornell's a bit bigger in terms of its size of the campus, but that idea of kind of being in the mountains, kind of a rural collegiate setting, was something I loved. My wife grew up in, she went to a college in kind of rural Ohio, and loved it there. And so we both kind of love this kind of academic town here and wanted to be a part of it.
That's great. And so when you're not working, and we're going to go back to the working aspect because that's what people want to hear, but when you're not working and you have all that free time, which I know you don't have much right now, starting a new family, but what do you like to do for hobbies?
Yeah, so I mean, one of the reasons why we're here is because we love being in the outdoors. So we go on hikes all the time. We try to get out every weekend. Every time we have some free time, we're trying to get out of the house. So a lot of that nowadays is with my two young boys. I have a 2-year-old and 4-year-old at home, and so they're not quite doing the backpacking trips yet, but we're working up to there and doing some fun family hikes when we can. But yeah, a lot of them is just kind of playing with the kids when they're at this age. It's a lot of fun.
That's great. I know that your group, your orthopedic group, which of course is a subset of our larger medical group with Dr. Namkoon and Dr. Nofziger, Schneiderbauer, Goodman, and Donovan, are all incredibly outdoors people, and I think came here for that reason. So you fit right in with them. That's great. And then also many of the staff, and that's super. So let's move back to hand and upper extremity. And a lot of people want to know, well, what is that? What does that mean to be an upper extremity surgeon? And how does that overlap with hand? And are those words synonymous in the medical field? If you could just elaborate on that.
Yeah, that's a good question. So there are hand surgeons, there are upper extremity surgeons, there are people that do both. And upper extremity is a bit of a nebulous term, a little bit. To some people that means fingertips to shoulder, and that's everything on the upper extremity. That is the upper extremity. some people, an upper extremity surgeon is anything above the wrist. So there are hand surgeons that just work on the hand and nowhere else. For me, I work, fingertips to the elbow. So I do some stuff up in the shoulder for sure. My fellowship, I did a fair bit of shoulder arthroscopy and shoulder replacement and trauma to the shoulder and the humerus. But we have two great sports surgeons here that do shoulder surgery here. So I've decided to kind of focus my practice here on more elbow down to the fingertips. And, it does go hand in hand a bit with the hand surgery. I mean, most fellowships where we train to be hand surgeons do involve a portion of the upper extremity, and it's kind of a natural extension. I mean, everything in the fingertips originates higher up there, right? So tendons, whether they go right, they're bending the tip of your finger, those tendons often originate above the elbow on the humerus. So you have to understand the anatomy of everything from your hand, fingers, wrist, forearm, and elbow to be a good, hand surgeon. So if you understand the anatomy, you understand how to treat those ailments. So, and same thing goes for shoulder. So if you understand the elbow, everything that crosses the elbow, often goes above the shoulder too. So you got to understand the shoulder anatomy as well. So I think it's the nature of, the way we treat things and understanding the tendons, nerves, muscles, arteries, where they come from. And if you understand that, you understand how to treat those conditions.
Right. For the audience, I can say even it wasn't until I was in residency before I started realizing the obvious, and that is the hand is so integral to livelihood, both the physical portion, but also for the occupational portion, but also just the societal portion. And that's why having a hand specialist is critical when those rare situations come forward. Your primary care doctor can take care of a lot of the superficial things, but when it comes to tendon injury, nerve injury, certain types of fracture patterns, that's what Dr. Veltre is trained for and what he does. Actually, so tell us a little bit about what you've seen so far and what types of conditions patients present to you with.
Yeah, so I've seen so much since I've been here. It's been really exciting seeing all the patients here and being able to treat them. The most common thing I probably see are nerve conditions, so like carpal tunnel syndrome, where people have numbness and tingling in their hand. It's usually worse at night or certain positions. I see a lot of people with trigger finger, which is a condition where there's a swollen tendon in the hand, and some of the fingers tend to lock up occasionally. I've seen people with contractures of the hands. Dupuytren's disease is a disease where some of the fascia in the hand gets tight and doesn't allow your finger to straighten up. So I see a lot of those patients. I see everything from wrist fractures to elbow fractures. I've seen kind of it all, which is kind of one of the exciting things about being here and being the hand surgeon within our group. Everyone's happy to let me take care of these really interesting conditions.
That's great. And then you also do cover, though, each of you covers your colleagues for call and weekend coverage. And how is that going?
It's going great. Yeah, it's actually one of the reasons why I wanted to be here. I do still like the general trauma, in orthopedic training. I trained at, the busiest trauma center in Boston, at Boston Medical Center. And, I feel like I got a really great training with the orthopedic trauma there. So yeah, I take care of hip fractures and tibia fractures and ankle fractures as well when they come in while I'm on call. And I really enjoy that part of keeping broad and doing all these bigger trauma cases.
That's great. So you're in, if a patient wanted to see you, you're in a variety of settings. You've got, why don't you just describe that? You're in the office, you're in the emergency department, the OR. Right?
Yeah, so I am in the office about 3 days a week. 2 days a week right now. I'm in Bennington, our office on Dewey Street, which is across from the hospital. I'm also in Williamstown once a week now. I have a clinic here, and I'm in the operating room a full day, usually every Thursday now. Who knows if that'll move around, but I'm very happy with the Thursdays. In my Williamstown office, I also do some local procedures. So local, I mean, doesn't need any sedation. You don't need an anesthesiologist. There are certain surgeries that I'm able to do in the hand where I just use some numbing medication and some other medications to control any bleeding. And I do them right here in the office. In fact, I just did one this morning. and I'll do that surgery, and patients really love that too, because they don't have to go all the way to the hospital. And I've had, particularly with the pandemic, people are really enjoy kind of just going here in the clinic here. They see, one or two people, they see my nurse, they check in, and then they feel a lot more comfortable here. But yeah, doing all those sorts of locations.
And you do carpal tunnel in the office?
Do carpal tunnels. I do trigger fingers. Those are probably my two most common office procedures. But I also do, any small finger surgeries here, like cyst removals or scar revision, stuff like that I can do with just a numbing medication of a finger.
So for the audience, if you have questions for Dr. Veltre and you don't want to submit those on Facebook Live, please use our website. You can send an email. I'll make sure he gets those questions and can respond. You can also listen to a past episode down from WAMC out of Albany, where Dr. Veltre was a guest for medical. I think it's Medical Monday, which is on Mondays, once a week. And we've had several of our physicians be on that show. It's an opportunity to do a call in real time, and Dr. Veltre was there recently. Just remind us, David, what is carpal tunnel and what is trigger finger, so that the audience, they've heard of it, they've had a relative with it, they're not exactly sure.
Yeah, so carpal tunnel is the most common compression of a nerve in your body, even the spine. So it is when one of the major nerves that goes to your hand, this one nerve is called the median nerve. It goes through a tunnel, essentially a tunnel within the wrist. It's covered by bone on one side of the tunnel, and the top side, on the palm side, is covered by a thick ligament called the transverse carpal ligament. And then for a variety of reasons, we don't always fully understand why, but the nerve gets pinched there, whether that's thickening of that ligament or swelling within those tendons. The nerve gets compressed, and you get numbness and tingling in usually three fingers: the thumb, the index finger, and the middle finger, and also one of the sides of your ring finger as well. So when we do the surgery for it, there are a number of ways to test for it. Often we can diagnose it with just a physical exam. If there are questions about whether or not could be a different nerve or it's compressed in a different area, we often get a nerve test as well, but we don't necessarily need a nerve test to do that surgery. And the surgery involves incision in the base of the palm. It's usually about an inch long. Okay. And we go right down there and we release that ligament and open it up so that nerve can breathe.
And the symptoms of carpal tunnel that people may be experiencing.
Yeah, no, thanks for reminding me. Yeah, so the symptoms are primarily numbness related, and when they happen is usually pretty telltale of carpal tunnel. So night symptoms that you wake up with numbness or even pain, kind of got to shake your arm off saying, oh, my whole hand feels numb. It's usually only those 3.5 fingers, but usually just kind of feel numbness all over it. So a lot of people don't even think about kind of which fingers are numb. They just feel like a numb hand. So night symptoms, symptoms while driving, like long drives where you're holding the steering wheel in an odd position, like with your wrist cocked back or bent forward, that can cause that symptom. So I always ask about those two. But I see a lot of people who have kind of work-related positioning. So, whether their keyboard isn't set correctly, they can get kind of numbness after being on the computer for a long time, holding their phone to their face with a kind of a bent wrist. That's often when you also get those symptoms.
I have to tell you, I was going to tell you this beforehand, but I need to get a veterinarian on the show, because I kid you not, my dog had tarsal tunnel syndrome. My wife and I are convinced, because he used to sleep with his paw folded in so tight. So we changed his bed, where he, after spending lots of money with x-rays and trying to figure out what was wrong with him, we changed his bed where it doesn't have this overlap that makes him do that. And now his symptoms are gone. So either we're great and we're veterinarians that diagnosed him, or it was total circumstantial. But if you ever hear about it in dogs, let me know. Dr. Veltre does have a hand pain webinar coming up at 6 p.m. on Tuesday, May 4th. You can register at svhealthcare.org/class-events. We'll make sure to put this on our website so that you can see that. Just sort of in closing, tell us a little bit about what some of the more challenging aspects and rewarding aspects of your job, recognizing you've been training for a long time, you've been practicing now, on your own independently for about a year. But what do you find as some of the challenges and some of the rewards?
Yeah, so I mean, I think in terms of challenging, I think part of the thing is that I'm always surprised every day. I'm always learning something new, whether it's about the patients here, whether it's about something technical, things I can do better. I'm always striving to do something better. And so part of the challenge is developing this hand practice from not having a hand surgeon here and kind of designing it our own way. It's a lot of work, and it's challenging, but it's been really rewarding. So I really, really enjoy that. And the other thing that I just find rewarding is the patients when they come back and see me after surgery and having a good result is just so rewarding to hear how whether it's improving their sleep because I did the carpal tunnel release and they no longer have that night pain, or whether they're getting back to work. It's just really those are my favorite days when I get to see patients post-operatively and hear about how they're doing.
Well, it's great, David. I would tell you we've had lots of such positive patient comments, but also from your doctor colleagues, your nursing colleagues, the non-clinical staff. We're just happy to have you and you add to the group. And thank you so much for coming. And we look forward to many years. We're out of time here for Medical Matters Weekly. I'd like to thank the audience. Again, if you have more questions, since this is a quick show, please send those in and we'll get the answers to you. Thank our guest, Dr. David Veltre of SVMC Orthopedics, as well as Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Healthcare, and Ashley Jowett from Southwestern Vermont Healthcare. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity, and we will see you next week.